Welcome to our podcast, Psychiatric Services from Pages to Practice. In this podcast, we highlight new research or columns, or in this case, a viewpoint, published this month in the journal Psychiatric Services. I'm Lisa Dixon, editor of Psychiatric Services, and I'm here with podcast editor and my co-host, Josh Berezin. Hi, Josh.
Hi, Lisa.
Today, we're going to be talking about a viewpoint that was recently published. I'm very excited about talking about the problem of homelessness and the opportunity that perhaps the pandemic has provided.
We're very excited to have Dr. Deborah K. Padgett, who is the professor at the Silver School of Social Work at NYU, and Dr. Daniel Herman, who's a professor at the Silberman School of Social Work at Hunter College, and the director for the advancement for CTI, here to talk about their viewpoint article, From Shelters to Hotels, an enduring solution to ending homelessness for thousands of Americans. So Dr. Padgett and Dr. Herman, thanks so much for joining us today.
Thank you.
Thanks. Thank you.
So as we usually do, I think it'd be great to hear a little bit about your backgrounds and kind of your career trajectories that have led you both into this topic and this particular viewpoint. So Dr. Padgett, maybe we'll start with you.
Okay, I'll go first, and then Dan, I think our careers have intersected over the years and we've gone somewhat different paths, but we were together at different times at the New York State Psychiatric Institute in the 1980s. And I was doing a postdoc at the time, and I had a Ph.D. as an anthropologist, but after 4 years of laboring in that field, I decided I needed some research skills. So I got this postdoc at Columbia to get an M.P.H, get research training. And while at New York State Psychiatric Institute, after I graduated, I began working with the late Dr. Elmer Struening, who was doing surveys of homeless shelters in the 80s when it was really just becoming, homelessness becoming a serious national problem. So somewhere in there, Dan, I met you, but I mean, we've been friends for 30 years, but I don't quite remember the details. Can you fill me in on, help me with that?
Well, I mean, we have in common that we're both probably from a similar generation and have been dealing with the problem of homelessness for many, many years. I first got exposed to the issue, I would say, in my first job as a social worker. I went to work for the City Department of Mental Health at this time, Mental Health, Mental Retardation, and Alcoholism Services, now the Department of Health and Mental Hygiene, that was dealing with setting up programs, some of the earlier programs in New York State to address the problem of so-called deinstitutionalization. So trying to set up community-based services for people who had been released from psychiatric hospital. And at that time, it was kind of a transition from that era to sort of it overlapped with identification of the problem of homelessness, even though obviously that there's no one-to-one cause and effect relationship between deinstitutionalization and homelessness. They have some common causes. So anyway, that's how I entered the field, and I've had a couple of different careers since that time. First, maybe 10 or 15 years were spent in public service and Department of Mental Health. I worked at state hospitals. I worked in voluntary agencies serving people with severe mental illness and homelessness and housing issues. And then I, through a unplanned transition, ended up in the research world. And that's how I met Deborah, actually, during that kind of transition into research training and connecting with Dr. Struening, who Deborah mentioned, during these early surveys. So
Can I just say, I love the notion of an unplanned transition. It's the best times of our lives, aren't they?
Well, that's ironic, since I suppose one of the models that I've been promoting for quite a few years actually is focused on planned transition. But I would say in my life, it didn't really follow that model.
Well, if you can get the planned transitions down, then if you get the unplanned transitions down, then the planned ones are maybe a little bit easier. So both of you have been at this for a while now. I guess before we jump into the article, I'm curious to hear about where you think we were prior to the pandemic in terms of homelessness. That's like a huge question, right? And I think that's, you know, a series of 5 or 6 podcasts on their own. But I'm just wondering if you could give kind of even like a very broad sketch of where you think we were, either in a particular city or as a country with homelessness. Like who are the players here? Like what are the strategies that we're talking about? What are the barriers? What's getting in the way of solving the problem? How big is the problem? Is it getting bigger? Is it getting smaller, more concentrated? Just that sort of like general idea.
Well, I came to New York just as the so-called epidemic of homelessness was really sort of peaking in the mid 80s. And, you know, the incredible visibility of people sleeping on the streets or in tents and so forth. But it was also becoming known in the country, and that I think is around 1987, the McKinney Act, and that later became the McKinney-Vento Act, was passed. And that was when, you know, there was a federal recognition that homelessness was a problem. And the McKinney funds went to mainly emergency shelters and other kinds of aid. I like to point out with reference to people, homeless people with serious mental illness, that really kind of unprecedented for its time was the New York Agreement, which first began in 1990. And what was unprecedented is, first of all, you had a city and a state get along well enough to form an agreement to mingle funds, but it was for the purpose of kind of the acknowledgement that mental health funds can and should be used for housing. And so we've had several generations of New York agreements, but it was a new phase sort of in dealing with homelessness, which is to target persons with serious mental illness and find ways to use mental health funds to provide supportive housing, as it was called, for these individuals. I think this is a New York thing. Across the nation, I think by and large, most cities and towns were dealing with homelessness through faith-based organizations, you know, missions, the Salvation Army, churches, synagogues, volunteers. And even though HUD and McKinney funding was continuing to grow, I think to this day, we still have a lot of localities, smaller towns, counties and so forth that are really relying on private donations and volunteers. What I've written about a bit and what I think is really surprising is that New York and LA they kind of represent two very different approaches to homelessness. And New York had the New York initiative. As of 1981, we had the legal right to shelter, which meant that someone could sue if they weren't given a shelter bed upon request, which no other city in the country had. And so New York embarked upon this period of spending literally billions of dollars in putting them into shelters with some commitment to supportive housing. Los Angeles, on the other hand, pretty much concentrated homeless people in a 52 square block called Skid Row, and mainly just had rescue missions there, you know, helping sort of in a minimal way helping. Now California's confronting the reality of what the path that they took. But I think before I turn it over to Dan, I'll just say that to me, the overall strategy over the years has been the assumption that this was kind of a temporary emergency and it would pass. And here we are 40 years later. But I think the real inflection point was the Reagan era in the 80s and the beginning of privatization and pretty much the end of the federal government being involved in building or expanding affordable housing, and actually leaving it up to the private sector or developers, and gentrification, which, you know, kind of left the people without adequate housing with really no other sources of finding, and without adequate income and finding housing on their own. Now, Dan, that's my quick take. So I'll let you really tell the story.
Well, I think you've done it very well to trace a history of a problem, a 40-year problem in 4 minutes. I guess what I would maybe what I would just add to it is that, well, I think where you ended, I mean, I think most of us think about the problem of homelessness on the broad scale as being one that is largely caused by a lack of inexpensive or affordable housing in many markets in many parts of the United States, and as you pointed out, one of the major contributors to that has been the pretty dramatic withdrawal of federal commitment to affordable housing now. And that the way that affects people with mental illness, as well as other more vulnerable populations, is sort of that the options become fewer and fewer, and so people who have fewer resources are the ones who are most likely to kind of shake out. So it's sort of like a musical chairs kind of a system. Mm-hmm. And I guess the other thing I would just emphasize, just what's unique about New York and why I think this issue that we were focused on is especially an issue in New York, but also in other parts of the country during the pandemic, is that New York, as Deborah said, is somewhat unique in having a huge institutionalized, publicly funded shelter system, and has for many, many years, and invests huge amounts of public funds into the shelter system. So as Deborah said, what was seen as a emergency response to a crisis has become a de facto solution housing provider, which I think all of us would agree is really inadequate for everyone, especially for people who may have high levels of need related to mental illness or other kinds of challenges. So, maybe that rounds it out just a little bit. And then in terms of of where we are with COVID, I think most people seem to think that the problem of homelessness is maybe the shelters, at least in New York, are at their highest level of census ever. But I think there's also concern that, especially as the eviction bans, the federal government has put in place bans on eviction through the CDC, as those expire, which looks like it could happen within the next month or two. Many people are expecting an even further onslaught of homeless people all over the country, and I would expect to see that in New York as well.
I just read today that 500,000 households in New York State are behind on their rent and could be affected by the end of this moratorium.
Right.
And that's just New York.
I'm curious. We're talking about really the social determinants of health here in many ways. And there's been a very important focus on structural racism and the vulnerability of people of color to these kinds of inequities and vulnerabilities. And I'm just curious how you all think about that, and what are the risks, and how do they divide across the population?
I have to answer that, if you don't mind, Dan, because I'm involved in the social work called the Grand Challenges Initiative. And one of the 12 grand challenges is to end homelessness. And they just added a 13 on structural racism, and they asked all of us to think about our grand challenges in the context of structural racism. And I can think of no better topic than homelessness as related to structural racism. And we wrote a chapter for a book that'll be coming out next year with Ben Henwood, who I work with, who's at University of Southern California. But first of all, you start with the proposition that African Americans are disproportionately represented in the homeless population. far more proportionately than they are in the US population at large. But it doesn't take long if you go back into history to see that after World War II, African Americans were basically shut out of buying homes, living where they wanted to, accumulating assets and wealth, such to the point that the average wealth is like 1/10 of the average wealth of a white person in this country. But what's more important is they were kind of they were systematically barred from buying homes in certain areas, getting loans, finding the way to generate wealth in the form of real estate or home ownership. And so by being crowded through segregation into less affluent areas of cities, and through redlining where white people were kept out of those areas and African Americans could not move into white areas, you had this cumulative effect of ghettos growing and of African Americans not having the assets that white people did. So they were in the game of musical chairs, you might say. They were often left out of the game entirely, I would argue. But in any event, structural racism is to me a major contributor to the social determinants or the socio-historical determinants of the homelessness crisis that we have. I mean, lots of non-Black people are homeless, but particularly the disproportion of African Americans, it's hard to avoid the historic precedents.
I'm just curious about how academics are thinking about the relationship between homelessness and mental illness, particularly serious mental illness. I think there's, in the popular press, at least, or in the media, this idea that they're very tightly correlated with each other, and that the so-called hardcore street homeless are people with serious mental illness, and if we can get mental health services in and housing first model, which I'm sure we'll talk about in a little bit, then that's really the solution. But Dr. Padgett, I know you talk in the article about the diversity of the population, and so I'm just wondering where how you both think of that and how the field thinks of the relationship between mental illness and homelessness.
When I was working with Dr. Struning back in the 80s, and since then, they've done epidemiological surveys of people, mostly people in shelters, but some on the streets. And the percent of people with serious mental illness, like schizophrenia, bipolar disorder, it's kind of what we're used to call the axis 1 disorders, it hovers around 1/3. So in other words, 2/3 of homeless people do not have a serious mental illness. And that gets lost, in the discourse, because the media picks up on the occasional person who's publicly in a disturbed state. And I say they may have been disturbed that day, doesn't mean they're going to be tomorrow. But I don't know, Dan, I get frustrated with that perception because it really is putting serious mental illness as a primary problem when it's really homelessness. And even taking serious mental illness as a serious problem in that person's life, it's not at the forefront of our homelessness crisis, in my opinion. What do you think?
No, I think I agree. I think I think it's fair to say that most estimates about the proportion of, the overall homeless population, at least the population of single adults, might be somewhere between 25 and 35%. Actually, just parenthetically, it's important to keep in mind that in New York, for instance, the number of people who are homeless in the shelter system or housed through the shelter system as families, in other words, typically a single parent with one or more children, exceeds the number of single adults. So, and the prevalence of severe mental illness or mental illness in that population is quite low. So that's important, just to keep in mind. We're talking about sort of a subset of the homeless population. And I would agree with what Deborah said, that in terms of the public perception being heavily weighted by people who are particularly visible, and perhaps particularly visible at a point when they're in a particularly disturbed public state in a public place, I think it does drive the perception of the problem away from, maybe a more accurate one. But I also think that we shouldn't negate the fact that people with severe mental illness, for a variety of reasons, some of those that we've mentioned already, having to do with government policy, are at elevated risk of losing housing and have a harder time competing for housing than others, so that housing related interventions and other services are really key, for that population. And that's kind of the group that that I've focused a lot of my career, focused on, and Deborah as well. So
there may be two ways to think about this. On the one hand, if you have a serious mental illness, you're at greater risk for homelessness than if you don't, in general. Right? Because if it's a third, that's still more than what we see in the general population. On the other hand, if there were no people with serious mental illness who are homeless, that thought experiment, the majority of people who are now homeless would still be homeless.
Mm-hmm.
So I think it's probably not either or, but both.
Mm-hmm.
Mm-hmm. I think that's true. And then I also think it's true to, we're talking about the causes of homelessness and to what degree mental illness contributes to homelessness. It's also important to keep in mind that homelessness can be thought of as contributing to mental health conditions. I mean, I don't think any of us would say, well, homelessness causes schizophrenia per se, but it certainly could contribute to poorer outcomes, a more challenging course, lack of access to treatment, and a whole variety of things that could drive the experience of people who have mental illness or develop.
Yeah, I mean, I often say that we don't pay enough attention to the trauma of just being homeless. I mean, when you talk to these folks and you listen to them, as both Dan and I have done with hundreds of people, it's hard to explain to someone just how traumatic it is, even though it should be obvious, what it's like to sleep in a pouring rain under in a doorway, and or on a snowy sub-zero night, and not know where your next meal is coming from, and not know if you're going to be attacked. So I think just being homeless itself is likely to precipitate not schizophrenia or bipolar, but certainly trauma and problems with anxiety, depression, which are quite likely to happen.
Mm-hmm.
So I don't think that's been given enough attention, frankly. I think we focus more on people with serious mental illness and think that's all of the issues we have to deal with.
Yeah. And whenever I clinically have been working with people who are homeless, I'm just amazed at the resourcefulness that you have to navigate these complex systems and stay safe and stay alive. They're sometimes some of the hardest working people that I've met in a lot of ways. Mm-hmm. Okay, so we'll put the history lesson to bed for now, at least. Although I think it does help to give some context. But the viewpoint is really about what happened during COVID, and this really rapid shift to having people move from shelters into hotels. So maybe you could just sort of sketch out the story about how that played out, how it went, why it happened, and how it happened so quickly.
New York City is known to be the place for shelters, where the vast majority of homeless people are in shelters, whereas California, which is always my kind of opposite, the vast majority of people were out on the street, in Skid Row and other places, and very few were in shelters. But when COVID hit, it became very obvious that one of the most crowded living quarters in the country are homeless shelters. And And so I think there was just general agreement that with the strictures and the emergency of the COVID epidemic, the shelters needed to, as they say, de-densify. That is, people who were sleeping literally like 1 foot away from the next person and sharing, meals and everything had to be moved. Well, coincidental with that, at least in New York and many places, there were hotels, like 200 hotels sitting empty. And some of them going bankrupt because they had no tourists, or clientele. So these two converged to produce a way to address the COVID epidemic and try to save some lives and not have these so-called hotspots in shelters. This could have been a disaster, really, if some measures hadn't been taken. So I think there was, just like in a larger sense, there was kind of a mobilization around masks and distancing. There was a sense something had to happen. And so the movement to shelters went pretty quickly. And by the way, it was really helped by FEMA funding. This wasn't like local people had to come up with the money to pay the hotels. The federal emergency funds were put forth to pay for these hotel rooms, and the money is still there till the end of September. Then after that, it's another story.
Yeah, and the Deborah has described kind of what happened here in New York, and this also happened in many other parts of the country, places that, as Deborah was saying, that don't have shelter systems. So in New York, where it was primarily a move from shelters, shelter populations sort of moved. In fact, in a lot of these hotels, what they basically did was they moved like a whole cohort of people in a shelter, moved to a hotel with the staff that was involved with overseeing their services in the shelter also moved into the hotel. So that happened. Plus, other hotels were opened for people who were not in shelter, but who were on the street or in the subways. As you New Yorkers will remember, subway system was closed down for the first time overnight. And so there were people. So at the end of the line, people were taken off the shelters, off the subways, and some of those people went into other hotels. So it was shelter dwellers plus street dwellers. I believe, Deborah, correct me if I'm wrong, I think in New York, it was approximately 10,000 people put into hotel rooms, homeless people. And then in other parts of the country, similar, maybe not on such a large scale, but similar moves were taken. And the using federal money, and now in I think many parts of the country are now trying to struggle with the problem of what happens now, and as we know, in New York, we're kind of just in the process, today, of people being moved out of hotels and sent back to shelter, even though there's been a fair amount of pushback against that.
That was the whole purpose of our article, is to kind of say we're at an inflection point, and we didn't make this up ourselves. There's barely been talk around the country, especially in California, to retrofit some of these hotels into livable kind of one-room kind of studio apartments. And otherwise, these hotels are probably going to be torn down, and developers are going to put in, and developers put in $1 million condos, and then in exchange for massive tax breaks, they have to dedicate maybe 10% to lower middle income people, leaving homeless people out entirely. So the idea of having at least some of these hotels turned into living quarters is sort of what we were trying to get at, with the understanding that there are obstacles to that. But the idea of starting from the ground up, bricks and mortar, building affordable housing, when you have these empty office buildings, empty hotels, it just seemed like this is a once in a lifetime opportunity.
I wanted, because a lot of our listeners are not New Yorkers or Californians, and you may not know, I understand that, but let's take a small town in upstate New York
Mhm.
or in Illinois or in Missouri or
Mhm.
I mean, there's homeless people, I think, everywhere. Um, and I'm just wondering, again, if our focus on serious mental illness as well, you know,
Yeah.
what did you see? And
I think both of us are much more conversant with the details in New York, but I have been following the story in some other states. For example, in a rural state like Vermont, Vermont pursued the same strategy, albeit for many fewer people. That's a state that had really no well-developed shelter system in most localities, but did have hotels that were underutilized and had the same concern about homeless people being vulnerable to COVID, and essentially did the same thing that we did here in New York on a much smaller scale. And now, sadly, they're facing the same challenge, which is, what to do for these people now that they're coming to the end of their federal funding and don't see a way to maintain them in hotels. And as one of the points we were making I've read similar stories in North Carolina, for instance. I mean, I think we've seen this all over the country. I think that as one of the points we made in the article, what it demonstrates, one of the things it has demonstrated, not that I think any of us probably would have doubted, is that if you provide people with a safe, decent private place to live, they will prefer that to the street or a congregate shelter, and their state of mind will improve, and there'll be a whole range of benefits that I think that seems obvious, right?
Dan, aren't you talking about housing first, which is my area of?
I'm talking about giving people a place to stay, whether it's a housing first or a hotel room. So I think that it's almost as if I can't understand why people seem so surprised that people have thrived more in a hotel room than living in the subway or on the street or in a congregate shelter with 50 other people in the room. So, I mean, but I think it's like shown that people can function quite well there, especially if they get the kind of supports that they need to be successful. So that's why I think it's such an important event that goes beyond just reducing risk of infection. Which is obviously maybe the first priority right now.
But I guess, being born a Kentuckian and knowing a little bit about my home state and other rural parts of the country, I mean, it makes me realize that a lot of homeless people are living in encampments and in places, kind of scattered about. And so you don't see the concentrations of homelessness, or, veterans have been known to form encampments, away from urban areas, so they'll be left alone. I mean, I think there's so many people who are homeless who aren't even coming to attention, by these programs or in these equations, and local continuums of care, as they're called by HUD, which are charged with taking care of homelessness in their jurisdictions. I mean, I don't know if any of those really had hotel programs. We tend to just know about the ones in the larger cities in California, so forth.
Has anybody, so the viewpoint is an argument that this was a good idea, this worked, and that it should be maintained, and going back to where we were is a big step in the wrong direction.
Right.
Is there any has there been any data that's quantified some of the, like, has violence gone down? Has there been more referrals to permanent housing from the hotels? Has there been any data that supports the common sense arguments that you brought up?
Yeah, the most, we cite them in the paper. Seattle is doing sort of a close, fine-grained follow-up of people in the hotels over a period of time, and virtually every outcome you can think of improved. Fewer 911 calls, fewer overdoses, people reporting better mental health, better physical health, more access to permanent housing, more ability to apply for entitlements, and just having an address and a connection to the world through having telephones and computer access and so forth. So the Seattle folks are showing, if you want to talk about quantification, they're definitely showing improvements. I don't know if, Dan, do you know of other research? I mean, we've been doing these small studies of interviewing, and we're in the midst of one now at a hotel in Midtown. But that's mostly qualitative and just sort of getting the texture and the context of what their lives are like in the hotels versus what they were like before.
Can you give us a sneak a preview? What are people saying about the experience?
Oh, I mean, I can't even, don't get me started. I mean, they're talking about, almost in terms of heavenly, intrusion into the heavenly saving. I mean, they give examples of just, being able to take a shower or put food in the a lot of these hotels have microwave ovens and little refrigerators, so they can go out and buy fresh vegetables. And they don't have to worry about theft, and they can lock the door, they can sleep. I mean, some of them say they haven't had a restful night's sleep in years, literally. Take a shower when you want to. It's just down to everyday things we take for granted. They tell us this is the first time for some of them in their lives, because the people we interviewed were all pretty in the multiple years of living in the subways and in the streets. And almost all of them had left the shelters because they couldn't take the crowding, the lack of safety, the drug abuse and all of that. So it's hard to, that's why we wrote the article, I think, is it's just like a revelation that because of this horrible pandemic, the emergency of the pandemic opened this door, and we just don't want to see it closed.
I'm so impressed by a number of things. I'm impressed by this notion of, again, this crisis and how it has been so horrible, but it has shined a light on a solution and in some ways given us a start. And I really hope that we take advantage of it. And so what should we do? We have listeners here who, many of whom have a role in the community, who are a part of the mental health system, many others who may have administrative positions, who have leadership positions. How can we help make this crisis, take advantage of what good we can get from this crisis?
Well, let me just say we are part of a group that is mentioned at the end of the article, a multidisciplinary group that is dedicated really to this. And there have been, I'm part of some other homeless advocacy groups where we're actually talking to candidates for public office about their positions. One of the really other nice aspects of this is that homeless people themselves have stepped forward and are now in the media and are extremely articulate and really telling the story and standing up to power. I mean, showing up where Mayor de Blasio is, for example, or even leading protest marches. So I think there is a silver lining in the sense that people are more motivated for change. Of course, the devil's in the details. And from my reading, even just changing the hotels into what I hope wouldn't be SROs, but certainly could be, depending on how they're handled, at least small studio living units as a pathway towards permanent housing. But doing that, still, you have to take into zoning. I mean, there's a real world out there, building permits, zoning restrictions. The whole system is kind of predicated towards private developers. And we've got to somehow remove those incentives, because there's tax incentives. The whole system in the United States is that if anything gets built, it's generally built by a private developer whose incentive is not to help the homeless. I mean, that's just the financial reality. So we've got to change some of those. I mean, what we're doing now with President Biden with the infrastructure bill that miraculously just passed, or is being passed today, is showing they've cut childhood poverty, I think, in half, in a short period of time with this infusion of federal funds. The same thing could be done with homelessness. And I continue to say we spend $3 billion a year in New York City. When I say this to audiences, they don't believe me. And most of that goes to shelters. So, if there's some way to divert some of those funds away from shelters, but also I think a lot of it's political will and a way to sort of have the vision to do it, and then grassroots activism. I don't know, Dan, I probably missed something.
No, I mean, I think it does come down to political will, and it comes down to to putting pressure on in communities to have a more equitable and sustainable solution to the problem. I mean, not to be I mean, I think it's also important to point out that there are some glimmers of hope. I mean, in California, the governor, the state government there has allocated, I think it's $2 billion, a huge amount of money
for them
to purchasing hotels, to and to convert them into housing for homeless people. So there's a clear way to do it. Perhaps, as Deborah says, federal money may be what's needed to really make this happen on scale in most parts of the country. But I think that's where the solution is. The solution has to be to move beyond shelter, to realize and accept that shelter isn't the solution. Shelter was an emergency solution 40 years ago, and it's not a solution to the problem.
Right.
But there are solutions, and there are housing programs and housing models that work. It's been demonstrated time and time again. So
I mean, this is the point where I have to get my plug in for Housing First, because I was part of Pathways to Housing in its early days. And let me just say that Housing First now is, the policy of much of Western Europe and Canada. It's in various places in the US, and it's certainly promoted by HUD. But the original Housing First started in New York City and was designed specifically and paid for by the Office of Mental Health to house people with serious mental illness. So Housing First had its origins in taking in people largely from the street or from psychiatric hospitals. And these were individuals that no one else would take, not even shelters often would. They would, leave them out or not enroll them in their programs. So Housing First started for mentally ill individuals, but it's now expanded. But the principle is there, kind of threaded through much of what we're speaking about. And it's been demonstrated, as Dan said, by research over and over again, showing that it works. Housing first, then take care of your problems, because you can't take care of mental illness or substance abuse or your health problems without a place to live, a home.
Amen.
Thank you.
Well, I think we'll end on that hopefully optimistic note that at least at this point we should know what works, and it's a matter of making it happen. So Dr. Padgett and Dr. Herman, thank you so much for joining us. It was a wonderful discussion. We really appreciate it.
And thank you so much for allowing us to have the article published, and we hope it'll get some reaction, good reaction.
Thanks very much.
Thank you.
Wow, that was intense and important. And again, I know everybody isn't necessarily going to agree with our speakers, but I think that the points are well made.
And one of the things I liked about the discussion is that it really merged a lot of high-level structural issues, historical, economic, with really their effects on individual people and how those two interact with each other, along with just the opportunity to really take advantage of something that otherwise was a terrible experience for a lot of people.
We invite you to visit our website, ps.psychiatryonline.org, to read this viewpoint we discussed, as well as other great research and essays. We also welcome your feedback. Please email us at psjournal@psych.org. You can also rate and review the podcast on iTunes, Stitcher, or wherever you listen to it. I'm Lisa Dixon.
I'm Josh Berezin.
Thank you for listening. We'll talk to you next time.
Bye-bye.
The views and opinions expressed in this podcast are those of the individual speakers only and do not necessarily represent the views of the American Psychiatric Association. The content of this podcast is provided for general information purposes only and does not offer medical or any other type of professional advice. If you are having a medical emergency, please contact your local emergency